But if you remember, there was a guy in America called Luigi who shot the CEO of one of America's biggest medical insurance companies because they were declining people's claims, and that was leading to adverse effects. People were literally dying. You would pay your medical insurance for many years, and then when you need cover, they would just withdraw, you know, consent, or they would not consent rather. They wouldn't agree or approve a specific claim to the point where you could be removed from the surgical table just before surgery because they at the last minute decided they don't approve your surgery. So those kinds of things have really, adverse effects on people's lives, and they're not the kind of things that we should let slide. Should we be going around, or should people have been going around shooting CEOs in the head? I don't know that will solve the situation. The company still exists, and if there's a change of attitude, we don't know. But I do think that there are many constructive and productive ways that are firm and assertive that can lead to better outcomes for patients and for the normal man. And care over harm is one of those avenues, right? So at this point in time, it's mainly about the collection of complaints so we can form a picture of, where the focus needs to be, really, where the bulk of the complaints are coming from, about who. Is it mainly private institutions or public institutions? Is it mainly public practicing professionals, medical professionals, or medical professionals that practice in the private health sector, or both? Or are they related to, medical insurance or medical aid, as it were? But it would help as a start. So the idea is that once we see cases that really point to medical malpractice and negligence, then we can, get those cases. We can get lawyers put on those cases and start pursuing them free of charge. For the complainant, and we can assess if the case, there's a good chance of winning that case. And the good thing is that if there's a settlement or a claim, it's recorded, so the complainant knows how much, actually was awarded, and how much they're getting and why.